Hi, my name's Brian Myers, and I'm a physician assistant here at Baseline Kaiser, and we're here filming a video on procedure standardization for the skin biopsy procedure. So today what we're going to be talking about is how to properly set up for an in-clinic skin biopsy for a suspicious lesion. For example, if a patient makes an appointment for a skin lesion that's been changing or that they're worried about and are requesting biopsy, then we often do that in the primary care setting. And so today we're going to talk about that setup. Whenever we're setting up any of our procedures as a part of this procedure standardization, every procedure has a picture that goes with it for easy setup, and this picture is like a visual recipe for what you need in regards to setting up this procedure. So I've used this picture to set up the actual ingredients for today's procedure, which is a skin biopsy. So with this procedure, I really like to break it down into two parts. One is preparing the patient, and the other is setting up the materials for the procedure. So as a part of preparing the patient, we want to make sure that we're exposing the site that's going to be biopsied. So just don't leave a patient in the room knowing that they have something in their back and perhaps they're old and need help getting undergarments off or getting shirts off. Make sure that you have the patient in the proper attire. For example, a gown if it's something on the torso or back, or if it's something on the leg. Let's not trust that patients can pull their pants up, because often their pants are too tight to get up to their thigh or a region where we're biopsying. Let's go ahead and put them in the paper shorts. And if you're biopsying them and they're going to be bleeding during that biopsy, we want to put a chuck under the site to be biopsied. So let's set up the patient properly. The final step of setting up the patient properly is remembering that our dermatology colleagues who will handle any positive skin cancer biopsies have asked that any skin lesion that's going to be biopsied in Kaiser now has a photo taken of the lesion prior to biopsy. So that photo is done with the camera, and what we want you to do is use a measuring tool. We have paper measuring devices, and then you'll attach a patient's name. So what I ask is that if a patient has a skin lesion, that you ask for the patient's support. Say, hey, I would like you to help me with getting a quality photo today, and I want you to hold this label just under the skin lesion for me. The reason why you want the patient to hold it is that gives you two free hands in order to focus the camera properly. We've had a lot of challenges with getting good in-focus pictures, and one of the things I think is our support staff is holding this out near the patient and holding with one hand and trying to focus, and that creates an uneven picture and an unfocused picture. So after the patient is holding the label and the measuring device in front of their skin lesion, you want to focus on the lesion by half pressing on the button, just like you would any point-and-shoot camera. A half click focuses, you'll hear a beep, and then snap. And try to keep your hand steady, because that'll get us the most quality photos. Alright, so after preparing the patient, the next thing we need to do is make sure we set up properly for the procedure. So with this procedure, we're going to lay out several ingredients. One of those, and first of all, is to think about the logical process for the procedure itself. And in this case, we want to think we're going to be cutting something off, so we need to numb the patient. So we're going to set out lidocaine. If that area to be sampled, the skin biopsy, is on the torso and not on a finger or something, we're going to use lidocaine with epinephrine to cut down on our bleeding. In order to draw it up out of this container, we need an alcohol pad so that we can open this and clean the top prior to taking off, drawing up our lidocaine. And then we're also going to need a syringe to pull up the lidocaine. And the syringe should be in this picture. It's not right now, so I didn't follow my list very well, but it is listed in the picture. And then we're going to need a needle. After we think about what we need for numbing, we also need to be able to clean the skin well. Once we take the biopsy, we're going to need a specimen container, so please have that out and go ahead and label it. For example, right arm, and stick it to the container. We also need sponges to absorb any bleeding. And then finally, we're going to need a device to cut off the lesion. And in this case, we're using something called a derma blade, which is like a straight razor. And we'll be folding this and scooping out part of that skin lesion. For some types of skin lesions, particularly ones we're worried about melanoma or rashes, we're going to be doing a punch biopsy. And that's why we want you to have 2 devices laid out for cutting off the lesion, because you never know what your provider is going to use. And then after the lesion is off, sometimes these bleed quite heavily, so we're going to use something like our hypercare solution to help clot it off. And so we need a Q-tip to pour the hypercare on. And then what I'm doing during my procedures is I have hypercare soaked Q-tip, and I'm pressing and holding on the recently cut out skin biopsy and putting pressure to cauterize the wound chemically with the hypercare. And then we have to think about, after we're done, we need to be able to dress it. So for some lesions, a large Band-Aid is going to be sufficient. And we'll also want ointment to protect from infection. Other lesions, though, let's keep in mind, might be large. So if it's a large one, let's go ahead and prep for your provider by having a larger bandage that we can use and set up with our HipaFix, which is an adhesive, cloth adhesive. And you can set it up by folding over some non-stick gauze and then leave this lying out for your provider to apply. The HipaFix allows us to adhere one side down and pull the other side tight to create a pressure dressing that will stop the bleeding and has greater absorptive capacities than just a large Band-Aid. Because really we don't want patients coming back later in the day because they've had issues with their dressing becoming saturated or getting blood on their clothes. So thank you so much for joining for this procedure standardization video for our skin biopsy procedure. And I hope you'll take extra special time and care to use our pictures to set up a great procedure setup so your providers can work quickly and perform these procedures accurately, as well as preparing the patient. You guys are wonderful, and thanks so much.